Page 1. This is Sheffield City Council's medication policy and was reviewed in 2018. It was put together by a leading Sheffield pharmacist, Steve Friedman, alongside a number of other health and social care professionals. Administering medication is a huge responsibility for staff and a really important task. We have to make sure that frontline staff and others feel safe and competent when providing this support. We encourage individuals to be as independent as possible with their own medication and to self-administer wherever they are able to do so. Page 3. The Sheffield Medication Policy 2018 takes into account various pieces of legislation, the Care Quality Commission and their standards of good care, NICE guidance and good practice. Page 4. Types of medicines. Staff provide support with all of these types of medication, including controlled drugs. Antibiotics, which are used to fight infections. Analgesics, which are used to relieve pain. Antihistamines, used to relieve allergy symptoms, for example, hay fever. Antacids, used to relieve indigestion. Anticoagulants, these are used to prevent blood clotting, for example, following a heart attack, thrombosis and some surgical procedures. Psychotropic medicines, these are used to treat depression, anxiety and schizophrenia. Diuretics, used to get rid of excessive fluids in the body. Laxatives, used to alleviate constipation. Hormones, an example of these may be insulin, steroids or hormone replacement therapy. Cytotoxic medicines, which are used to treat some forms of cancer. Page 5. Types of route. Ingestion. These can include tablets, capsules, mixtures which are swallowed. Topical. Creams, ointments and lotions. Inhalation, oral or nasal inhalers, instillation, eye, ear and nose drops. Injection, subcutaneous, IVs, IMs, infusion, intravenous drips, rectal, suppositories, enemas, vaginal, pessaries, internal vaginal creams. Page 6. All routes on the left-hand side of the slide can be administered by staff in social care. Carers can only administer medicines by 4 routes. Orally, by mouth. Topically, by application to the skin. By inhalation, using nasal sprays and inhalers. And by instillation, using eye, ear and nose drops. All routes to the right must be supported by other healthcare professionals. A common scenario within short-term intervention, often after courses of antibiotics, one of the side effects we come across is vaginal thrush, and people we support often ask us to provide support with cream application. As stated above, we cannot provide this support. This must be referred for medical or district nursing teams to support. Page 7. Types of NHS prescriptions. GPs can write prescriptions, dental professionals, some nurses have added responsibilities and are able to write prescriptions, outpatients department in hospitals, supplementary independent prescribers for some specialist medical services, and the electronic prescription services where prescriptions are sent directly to pharmacists and they then deliver the medication.
Page 8. This is an example of a National Health Service prescription. This will be the front part of the prescription. On this, you will clearly see the name and the address of the person that this belongs to. The age and date of birth are commonly included. These provide an important safeguard so that the pharmacist can assess the appropriateness of the dose. The medicine. The name of the medicine can be given as the brand name, as in the case of Amoxil, or as the generic name, amoxicillin. The form of the medication in this case is a capsule. Other forms include tablets, creams, ointments, lotions and injections. The strength of the medication will be indicated on the prescription. Each capsule contains 250 milligrams of the active medicine. There may be other strengths available, such as 500 milligrams. The dose, in this case, states 1 TDS. This means 1 to be taken 3 times a day. Quantity. Mite is the Latin word meaning send, and here the doctor has asked for 21 capsules to be prescribed. The signature, date and surgery address will be present, and the security number, which is very unique to every prescription and is to prevent fraud and track fraud. Page 9.
The NHS prescription, the back. The back of the prescription is primarily used for the patient or their representative to declare the reason for an exemption from payment. The person signing the declaration is legally responsible and may be liable for any inappropriate claim. Support workers must be aware of this responsibility. However, being able to provide evidence of the exemption status when collecting a prescription from the pharmacy does not stop the patient receiving the medicine. The pharmacy staff indicate on the back of the form that no evidence was presented. Collection of CDs. This was introduced for controlled drugs and their collection. It was as a result of the Harold Shipman saga in which this GP wrote copious prescriptions for controlled drugs. No one was monitoring or checking how many of these prescriptions he was writing or collecting, and went on to murder a number of individuals. The person collecting the medicines, because they are classed as controlled drugs, are asked to sign for them. They will be asked to provide some identification. If the collecting person is a healthcare professional, they will be asked to provide further authenticating ID and possibly an address. The pharmacist may use their discretion when no proof of identity is provided.
Page 10. Ordering prescriptions. Who orders prescriptions from the surgery? This could be the patient themselves, a family member, or a support worker. We can be involved with this arrangement, but it must be recorded in the individual's care plan. Staff must ensure that they read the care plan and communicate with the individuals responsible should they be concerned that supplies are running low. Page 11.
Safe storage of medication. Support workers should ensure that all medication is stored in a secure location in the individual's own home, and that's only accessible to the support worker or other authorised persons. We have to consider whether they should be accessible by the patient and consider their mental capacity. Medication should be stored in the agreed designated area. Generally, we find people often keep them in a particular cupboard, a tin or a carrier bag on their side or on their dining table. Where possible, when the assessors go out, we try to support the individual to agree a safe place to ensure that staff know where to access and leave it for consistency of care. Again, this all should be recorded in a person's individual care plan.
Page 12. Safe storage of medication. Some medicines, and an example of these may be insulin, Xalatan eye drops or Dactotalk cream, should be refrigerated to ensure their safety and effectiveness. This information should be on the label of the medication and in the individual's care plan. It is acceptable to store medicines requiring refrigerated storage in a domestic refrigerator. However, do not store medicines in or immediately adjacent to the icebox of a refrigerator or in the freezer compartment of a combined fridge-freezer. Do not store medicines adjacent to uncooked meats or other food. Store medicines, if possible, in a door compartment that can be reserved for medicines. Page 13.
The 6 rights of administration. Within the policy, there are 6 rights of administration that all staff should adhere to. They have to check that it is the right client, identify the individual by name, there could be more than one person in the household, explain to the individual it is time for their medication administration, and explain the technique to the individual. Assist the individual to a comfortable position, either sitting or lying, and do not administer the medication whilst the individual is standing. It has to be the right medication. Staff have to read the medication record and take the appropriate medication from the shelf drawer or refrigerator. Warm the bottle in the palm of your hand if stored in the refrigerator. Compare the label of the medication container against the MAR chart. If these are not identical, recheck the individual's record. If there is still a discrepancy, stop and seek guidance from manager, GP or pharmacist. It has to be the right time. We have to give the medication at the right time. It has to be the right dose. Checking medication data is essential to prevent a medication error. It has to be the right route. Give the medication by the ordered route. Every individual has a right to refuse. The individual may not want it at that particular time. We cannot force people to take their medication. Our role is to support and encourage. We can inform individuals and explain the consequences and needs of not taking the medication. We must then record and monitor subsequent situations. If, for example, a pain relief medication is refused, this may be okay short term and monitored to observe ongoing reactions. However, some medications, e.g. anticoagulants, warfarin, blood thinners, are essential to the well-being of the individual's health. This would need to be monitored very closely and advice sought from a health professional if an individual was refusing to take this type of medication.
Page 14. There are 3 laws of administration that must be followed. Number 1. Prescribed medicines are the property of the patient named on the prescription. Medicines prescribed for one patient may not be used on another. Patients have the right to refuse. The service user's authorisation to dispose of unwanted medicines must be sought. Law 2. Anyone may administer a prescription-only medicine providing it is in accordance with the directions of a doctor. This is with the exception of injections, following the instructions on the label. This enables carers to administer a prescription-only medicine. Law 3. Doses of prescribed medicines may not be varied without the doctor's consent. Medicines must be administered according to the instructions on the label, and this must be followed at all times. However, there are circumstances by which the dose may be varied. An example of this is an anticoagulation drug, which could be used for blood thinning. These situations mean that doses can vary, sometimes daily, weekly or monthly. All warfarin medication is recorded on a separate medication record just for that particular medication. Page 15.
Administration. Level 1 is prompt and observe that the medication has been taken. Level 2 is physically remove the medicine from containers and administer to the patient. The required level of support will always be recorded in the person's care plan. When the assessors go out, they look to see what a person can do and what they need support to do. We want people to be as independent as possible with this particular task of administering medication, and if they are able to do so, we want to promote their independence with this. Some people may be very able to take their own medication, but just need a reminder to check it has been taken and will therefore just receive level 1 support. There is no MAR chart for this level, however it is expected that the communication sheet identifies that the individual has been prompted and has taken their medication. It is important to remember that medicines must not be left unattended.
Page 16. Administration of medication. Prescribed medication must be in a labelled container as supplied by the pharmacy or dispensing GP practice. All medication must include details of the patient's name, the name of the medicine, often including the strength of the medicine, the dose to be taken, e.g. 1 tablet or 2 tablets, or 5 milk spoonfuls. It must also indicate how often the medication is to be used. Care workers must not administer medication that is not in a labelled container. Page 17.
Administration. Most patients receiving support with their medicines should have them dispensed into bottles and boxes. Under certain circumstances, it may be appropriate to have their medicine supplied in monitored dosage systems, MDS, such as a Nomad tray. Such systems are for the benefit of the patient and are an independent aid. Some tablets are not suitable for dispensing into an MDS tray, e.g. soluble tablets, Nicorandil, often used to treat angina, sodium valproate, often used to treat epilepsy. Patients needing an MDS pack will have been assessed as such, and this will have been recorded in their care plan. As I said, this is considered an independent aid and we would not normally be involved with the administration.
Page 18. The medicine label. All labels have the following elements: the warning to keep out of the reach and sight of children, the medicine form, name, quantity and strength, the directions of administration, any warnings that are applicable to the medicine, the patient's name and date, and the name and address of the prescribing pharmacy. Page 19.
Directions. The prescriber's directions should be followed with the doses being spread as evenly as possible throughout waking hours. Care plans can be altered to accommodate this. Some types of directions are: 1 to be taken each day, take at the same time each day, every 24 hours, usually given in the morning, 1 to be taken twice a day, generally morning and evening.
Page 20. Other directions. Other directions that you may see on a label are: before food. This medicine must be taken on an empty stomach, i.e. 1 hour before meals or 2 hours after meals. With or after food. These medicines may irritate the lining of the stomach. A drink and a biscuit or a piece of toast will be sufficient. A full meal is not necessary. As directed. If medication is labelled with imprecise or ambiguous directions, for example, take as directed, take as before, apply to the affected part, the support worker must seek clarification through their line manager. This instruction is useless and means nothing. It gives no clear direction. We must go back to the pharmacist and ask, what does this mean? When should it be applied? And how should it be applied? Page 21.
Medication not on the MAR chart. There may be occasions when the medication to be administered is not on the MAR chart. For example, an individual may require a course of antibiotics for short-term use. Where possible, we should ask the pharmacist for an additional MAR chart. This is not usually an issue. In all such cases, if we are not clear, we need to seek advice from the appropriate contact. It will be necessary to ensure records are maintained on the communication sheets for this medication where it has been administered.
Page 22. Giving the medicines, tablets or capsules. Personal protective equipment is required when supporting medication administration. This is to ensure infection prevention and control and to ensure medication is not absorbed onto the skin of the person administering the medication. Hands must be washed prior to application of gloves and after disposal of the gloves. We must maintain communication with the individual throughout the whole activity and promote independence as much as possible. Tablets must be given one by one and signed for after each has been taken. Take the medicine to the service user. Ensure the service user is sitting upright or standing. Give the medicine and offer a drink. Make necessary records in the MAR sheet and also in the communication sheet if there are any added details before proceeding to the next medicine. We have come across situations where the individual has requested all their medication together. We would always advise that our policy and good advice is to administer one by one. However, if a person insists, this must be revisited and assessed and identified on the risk assessment in the care plan. Page 23. Topical medicines, creams and ointments. When supporting individuals with topical medicines, creams and ointments, it is important to ensure the privacy, the dignity and the comfort of the person you are supporting. Personal protective equipment is required to complete this task. It is necessary to wash your hands before putting on disposable gloves. Gently cleanse the area to be treated to remove any previous residue. Remove sufficient cream or ointment for a single application and apply to the area, gently massaging in where appropriate. Remove gloves, dispose of them in the bin and wash and dry your hands. Any further applications will require fresh gloves and the procedure to be repeated. Complete all required MAR sheet and care plan notes. Some individuals may use creams that are not prescribed. An example of this may be someone who has always used a body lotion after showering. We are able to support with this, however it must be reflected in the risk assessment in the individual's care plan. Page 24.
Steroid creams. Steroid creams must be applied sparingly. Steroids can be absorbed through the skin and may have unwanted effects. For this reason, they should be applied sparingly, which is usually a pea-sized application. This is enough to cover an area equivalent to the back of the hand.
Page 25. Patches. Patches can be used for pain relief, hormones and most recently to support with pressure areas, which is a new way of protecting vulnerable areas of the skin. Page 26.
Patches. We are involved in administering patches. Staff are expected to wear gloves, remove the old patch, dispose appropriately in household waste, remove the residue, apply a new patch to the new area, but do not write on the patch. Press with palm for 30 seconds, wash hands, remove gloves, enter the records on the MAR chart and body chart if used, sign off and sign on. Staff are allowed to get involved in transdermal patches. These are very useful for providing a steady dose of the drug which is unaffected by factors such as food in the stomach. The dose is provided for long periods, which may be up to 1 week. Patches are commonly used for hormone replacement therapy, nicotine replacement, contraception, anti-nauseant, pain relief, and most recently with pressure area relief. Fentanyl patches are available as a number of brands: Duragestic, Tylafil, Matrifen. They must not be cut in half, as this will affect the delivery of the drug, although they are safe if used appropriately and care must be exercised.
Page 27. This is an illustration of a body chart that you will find in the individual's care plan should they require the use of patches. It is important to indicate where and when the patch has been removed, and also indicate where and when it has been reapplied. Page 28.
The Marchart. Sheffield City Council commission a Marchart service from pharmacies. To trigger the service, a copy of the Medication Administration Authorisation Form must be provided to the nominated pharmacy and to the GP. Without this form, the pharmacy is under no obligation to issue a Marchart. The pharmacist will only issue a Marchart when dispensing the prescription, not at a later time. Neither will they issue a spare label to be added to the Marchart by the support worker. Where a mid-cycle prescription is being dispensed at the pharmacy, it is a good idea, although not always possible, to take the existing Marchart so that a fresh label can be applied to it, rather than the pharmacy issuing a whole new card. There is some restrictive space when staff are completing the Marchart, particularly where they are placing their initials, and staff have to take care and pay attention to be as clear as possible. The medication details should be the exact same as on the label, and it is staff's responsibility to check this. The pharmacist is not responsible for putting in the dates, therefore we must take absolute care to ensure this is correct. At the top of the record there is a box to indicate the number of sheets an individual has. This could be numerous. It is important that we check all sheets where it states 1 of 3 during administration to prevent errors.
Page 29. The Marchart. The Marchart is a legal document which performs 2 key functions. It provides a record by initialing in the appropriate box all medicines administered to the patient except those which are self-administered. It provides a clear audit trail for medicines received, administered and disposed of. Where a Marchart is not available, the medication administered should be recorded on the person's care plan or communication sheet. The support worker should inform their appropriate contact where this is happening so that arrangements can be made to provide a Marchart for any further prescriptions. The current medication administration record, the Marchart, should be kept in a safe place in the service user's home, which will usually be in the care plan. Page 30.
The Marchart. This is a must for every person being supported with their medication. It should have details of the person, the surgery, the pharmacy, any allergies, details of the medication, a record of administration and destruction or disposal, a missed dose record, variable doses, and Marcharts must be numbered, e.g. 1 of 3, 2 of 3, 3 of 3.
Page 31. The Marchart. The Marchart has a code. This code must be observed. It may indicate R for refusal, H for someone who is hospitalised, N for nausea or vomiting, X for not given, and O for other. Missed doses must be recorded. The prescriber should be kept informed where the patient refuses to take the medication, as this may impact on the treatment. It may be possible to prescribe an alternative which the person will be prepared to take. 96% of pharmacists across the city are signed up to the Marchart specification and will provide Marcharts to individuals whom require them. It is important where an X is recorded that some description is recorded within the care plan to indicate why medication has not been given. Page 32.
The MAR chart. Refused doses. The line manager should be informed where an individual refuses their medication on more than one occasion per week. The line manager may then seek advice from the individual's GP. There may be a number of reasons why the individual refuses their medication, e.g. taste, side effects, improved symptoms, etc. The reason for refusing must also be recorded. Staff should not use refused when administering PRN doses of medication.
Page 33. We must be aware of any reactions. We must monitor, record and take action where we think there may be any adverse effects of medication. Page 34.
Staff are responsible for monitoring side effects to medication. These can take different forms. Side effects are usually listed in the patient leaflet. However, patients may need to be reassured that many side effects are short-term and do not necessarily affect all patients.
Page 35. Side effects. There may be side effects to some medicines. For example, sleeping tablets, sedatives and antidepressants may cause mental confusion or drowsiness. Blood pressure tablets may cause fainting or unsteadiness. Antibiotics may cause rashes and painkillers may cause constipation. We must also be aware of paraffin-based creams. This should be indicated on the label and be noted in the risk assessment. The paraffin within the creams locks in moisture and helps prevent itching, so is prescribed for eczema and psoriasis, for example. There was an incident where an individual was being supported with a paraffin-based cream which was applied to his legs. The individual was a smoker and struggled with alcoholism and self-neglect. Creams were applied to his legs. However, during smoking, his trousers ignited. As a result of the paraffin within the cream, this individual died. Risk assessments must be put in place at all times where paraffin-based creams are used. Page 36.
Administration errors. We have a duty of candour. We have to be open and honest and transparent. It's not good practice to hide or cover up any of our mistakes. It's good practice to always report and record. We have to report any administration errors immediately to the appropriate contact. The service has an incident reporting system which must be followed. Sometimes GPs need to be contacted unless it's trivial, e.g. missed paracetamol, and we have to monitor the person.
Page 37. As previously stated, any discrepancies must be reported and recorded immediately. Failure to record administration on the MAR chart could result in a second dose being administered to the individual. Missing medication. Some medicines are liable to theft and abuse. Such discrepancies should be reported immediately. Some medications do have a street value, particularly the controlled drugs we often support with. An example of this may be tramadol or morphine. Such discrepancies must be reported immediately. Page 38. Thank you for your attention. End page.